Hello and welcome to UC San Diego. Thank you for joining our webinar on healthcare requirements for incoming students. This webinar is presented by Student Health Services Director of Nursing, Annie Horn, who will be overseeing the incoming requirement process for the university. The Student Health Services nursing team will be your point of contact throughout this process. They are here to support you as you work through these health requirements. This PowerPoint will be posted on our website under Health Requirements for Students. You can also find a direct link in the chat, and I will repost it very soon. Many frequently asked questions will be answered throughout this presentation, but we will also have a designated answer and question time at the end. Please utilize the question and answer feature in Zoom to submit any questions you may have. I'm going to go ahead and turn it over to Annie.
Thanks so much, Helen, and welcome everybody, whether you're coming to us from somewhere in San Diego or in California or somewhere in another state or from another country. We're really happy that you're joining the UCSD community, and this webinar is to help you understand a little bit about our incoming health requirements. These are for all of the University of California campuses. We'll be focusing today specifically on our requirements and how we run this process. We're very happy to answer all your questions at the end of this. If you need very specific health questions answered in relation to these requirements, I would encourage you to reach out to us in a different way that's not so public, so that we can dig into the details a little bit more and keep your information private. But general questions, really happy to answer anything. I'd like to just go over our webinar outline and the types of things that you can expect from today's session. We're going to go through why we have these health requirements and when they're established, what they are so that you can get prepared, how you can make a start, and we'll be looking really specifically at My Student Chart, which is the patient-facing or student-facing part of our electronic health record in Epic. We will be digging in a little deeper to the tuberculosis requirement and the specific immunization requirements. Then we've got a whole lot of FAQs that we are very accustomed to answering. I will review the deadline dates and the dates that academic holds are placed for not attending to these requirements. We'll look at how to get help, where to reach out, so that you can avoid getting academic holds. And then, as mentioned, we'll go into a live question and answer. So feel free to use the Q&A feature of this webinar. So first of all, why does the UC have health requirements? Well, we over the years have seen outbreaks of various illnesses and diseases, and we know that illnesses that are communicable in ways through the air, so droplets and airborne ways, students are particularly at risk of because of the way that university housing is with lots of folk, and also in lecture halls and dining halls. We really want to prevent as many vaccine preventable diseases as we possibly can. Outbreaks cause a lot of academic and personal disruption. For example, with quarantine and isolation times for measles, it can be between 2 and 4 weeks. So you can look at being out of class for a big chunk of a quarter, which could totally delay when you are able to achieve your degree. It may increase expenses, and so it's really important to do all of these before you come to the university as much as possible to prevent these diseases. And we're definitely, unfortunately, seeing reemergence of things like chickenpox, of measles, of meningococcal, and we have very, very recently seen some of these as well as a case of tuberculosis. So we're very invested in preventing as much of this as we possibly can to protect our entire community. What are the requirements? So we have kind of three categories. The first one, and I always put that first because it's the thing that really does need to be done before you come to campus, and that is tuberculosis screening. And for those that are at higher risk, testing will also be required. And with TB, we're actually preventing active disease from coming onto campus. with our immunization and vaccines, we're wanting prevention. So we're looking at Tdap, measles, mumps and rubella, chickenpox, and the meningococcal ACWY vaccine at preventing these illnesses. And then vaccines that are due once you're at school include influenza and COVID vaccines because these are released. New doses are released every fall. So we give you additional time for those ones. And in terms of starting the process, I do just want to say that everything that I present here can be found on the Student Health website. And it's a really good place to dig into if you've got questions. This webinar will be posted there and my slides, so it's a fantastic resource. And I would like to give you a quick tour of our website just so that you know where to go and how to access this information. Okay, so this is the Student Health Services website. We are a cluster of multiple arms of, we have counselling, psychological services, we have our sort of insurance and administration, health promotion, and then our student health services. So student health services is where the healthcare portion of our cluster is delivered. And on our website, there's multiple places of getting information on these requirements, as well as many, many other things. Um, you will see it on popular links, that always there, as well as under resources. You will find our health requirements there. It's a very popular page for folk to visit, and on here we have all sorts of good information, definition of what an incoming student is, which includes all new undergrad and grad students, transferring students, students transferring from undergrad to grad also need to complete these requirements, even if you have done them previously, transferring students and readmitting students. We've got information here on how to sign up for My Student Chart if you're having difficulties with that. We have a summary of all of the deadlines and academic hold dates for the upcoming 2025-2026 year. It has the TB requirement here, and if you are required to do testing, there is the form here that you can take to your healthcare provider with all the details and clinical information that we need for this. We have the immunization requirements and the form. You don't have to use our form, but it's a really great option. It's got all of the instructions and contact details, as well as really good information for your healthcare providers to know exactly what it is that we need, and if you're missing anything, you know, what they may need to provide you. The second page are highly recommended but not required immunizations. So if you've had these vaccines, you can definitely put the dates on here and also enter them into My Student Chart. I've got some really good information here on all of the vaccines, as well as common names of those, brand names of those vaccines, including names that you might find in other parts of the world, and also just specific notes if there are alternatives to those vaccines, for example, blood tests for measles, mumps, rubella, and chickenpox. And then I'll also go through all of these other strongly recommended vaccines. There's some information here on the COVID-19 vaccine and how to submit. There's information also on the influenza vaccine. There is a section on exemptions, medical exemptions, religious exemptions, and the appropriate forms. All of the forms involved in this process can be found under this tab. There are fantastic links here on vaccines, TB, the policy itself, where the policy was derived from. So it's really, really good info there if you want more. There's information here for our International Extension Program students, as well as our professional school students that are coming in for the School of Medicine, School of Pharmacy, and the Physician Assistant Education Program, as well as ways of asking questions. So really, the first thing that we want you to do is signing up for My Student Chart. And on that website at the top, there's always a link to sign into My Student Chart. As I mentioned, it is the student and patient facing aspect of EPIC, which is our electronic medical record. You will need your UCSD student AD login, which is the email and the password that you select, which is issued to you by campus soon after accepting your admissions. If you are having any issues with that AD login, there is a website link here, which is on Blink, which is a UCSD website that you can get help for around that. This is the landing page, and I just want to highlight the appropriate place to log in. You will see there's a very specific spot that UCSD students go in, which is a very different way than regular patients entering this portal. So you shouldn't be using a username or a password. You should be using your UCSD AD Active Directory login. So if you get in there and it looks a bit strange, come back out and go back into the correct place. If you go in using the wrong version, then you won't see the incoming requirements or the forms that I am going to show you very soon. So again, step back out and then go back in using your AD login. So now I'm going to do a bit of a live demonstration of what my student chart looks like. This is a a fake playground version of this, and so I'm going in a slightly different way. This will say my student chart, not my UCSD chart, but otherwise it is identical to what you will see. So you log in, and there'll be all sorts of messages here. There might be alerts for health screenings that might be more specific to your age, but there may also be vaccine reminders on this. Do put in a notification in terms of your email address if it's not in there, your current cell phone number, so that you get notified when there are new messages from us. So this will be used if you use Student Health as your healthcare provider. This is where you communicate with us, where you can book your own appointments. And so this is a really good resource to dig into. It's also where your test results will go. But for the purposes of incoming requirements, I'm going to show you where to go for this. Everything is located in the menu essentially. The first place is the Student Health Ask a Nurse. So that comes to myself and my team, and any questions that you have regarding this process or any aspect of your health really can come through Ask a Nurse, and you can choose a topic for this. It'll be immunizations or TB, and you can type us a message. Now, this is linked to your student account, so you don't need to state what your student ID or name is, because we can see that already. And these are answered within 24 hours usually. Sometimes if it's a weekend or a long weekend, it may be more like 72 hours. And certainly around deadlines or around hold dates, it gets a lot of traffic. So this is why we urge you to get onto this process as soon as you possibly can to avoid those real peak times. But we have a big team of folk here that can answer most of your questions, and if we don't know, we can find out for you. The next place I want to show you is the COVID-19 spot. So this is where it's really useful to go in here first. And if you hit update, it will pull in not just COVID vaccines from the California registry, but from other EPIC sites. If you've got a healthcare provider that also uses EPIC, it will drop in not just your COVID vaccines, but any vaccine. So it's a really good spot. You have the opportunity to enter your vaccine doses in here, current or past ones, as many as you like. The next place is immunization and screening. Now, this is where your tuberculosis and your immunizations will go. The first piece is TB screening, and you will get a series of questions that you will answer. And when you hit submit, it will tell you whether you need testing or not and indicate. And the form is on our website, or you can come back in to this screen and the form link will be in there for you as well. And also, similarly, the immunization page. On that page, you will have lots of boxes to fill in. There are more boxes than vaccines need to be filled in, but we've put those there in case you get booster doses and have had more than the recommended number. If you hover over the little info bubbles, you will get more information on what that requirement is. If you come from a country where, for example, you've been given individual vaccines for measles, mumps, or rubella, there's spaces there for you to add those. If you've had the blood test instead of the vaccine doses, there's a place there to enter the positive blood titer and upload a document. And then right at the end, there's also all spaces here to add all of those highly recommended vaccines that many of you will have had. And then at the end, you can upload your either our form or your own vaccine record, whichever is easiest and you've had filled out. And then that gets sent through to the nursing team and they will review your documents. The only other place within here that I would like to point out in the menu would be you can enter your vaccine, your influenza vaccine in here. I'm just having trouble seeing where it is, but somewhere in here it should say preventative health, and it might be further up at preventative care. And when those are due after 1st of August, that becomes available for you to enter in as well. It will also show you all of the vaccines you've had, anything that's overdue. So that's also a useful page to be able to reference. So now we're going to go into the tuberculosis requirement. And so, as I said, there's a TB risk screening questionnaire that you do first of all. If you're prompted, then you take the form to your healthcare provider to get testing. Testing can be skin testing, or PPD or tuberculin. There's got lots of different names. It's all the same thing. It's where a little bit of tuberculin is injected under the skin, and then that test is read in 48 to 72 hours to see if you've had any degree of reaction. The second form of testing we accept is an IGRA blood test, commonly called quantiferon or T-spot testing, depending on the lab that your healthcare provider uses or that your country has available to you. This is a gold standard in TB testing. It is the preferred form of testing, but we also do accept the other two. Or if you can't get access to IGRA or quantiferon testing or skin testing, then the last option would be a chest X-ray. You will also be required to do a chest X-ray if your skin test or your IGRA blood test is positive. So we will want you to go on to get a chest X-ray, and you'll need to go back to your healthcare provider to get that ordered. That needs to be uploaded in English. They're quite complicated reads of the chest, so we really need to be able to understand exactly what's going on there. And a registered nurse will be reviewing those test results and will communicate with you. So very important to return back to My Student Chart on a regular basis, and that's why I say have those notifications turned on. That way you'll know when we've sent you a message, because we may say the skin test was read too early, we need you to do additional testing. Or the chest X-ray is not quite normal, we need you to do something else. So it's very important to avoid getting a hold that you check back and see those messages coming back from us. We will let you know with TB testing once we have processed those testing forms, and if there's anything else, or whether you are considered complete. If you have a positive skin test and a negative chest X-ray, we will be following up with you during the full quarter to get quantiferon testing. If you only submit a chest X-ray as part of your clearance, we will be chasing you also in the fall to get a quantiferon test, because a chest X-ray doesn't tell us if you have something which is very common actually called latent TB, which means that you've had an exposure to TB. You didn't contract the disease itself, but you do have the bacterium in your blood. And it is very important to get that treated so that it doesn't convert to active TB. So we will be following up with you to get treatment during the full quarter, but we do that once you're in school. And again, please complete all of this as soon as you can, because sometimes it does take longer than anticipated. Now the immunization requirements. So the deadline is July 14th, which is the same as the TB. However, we don't place holds, so the holds for TB go on at the end of July, whereas the holds for immunizations go on at the beginning of November. We give you some additional time if you cannot access particular vaccines in your country or your state, or you may not have insurance. We allow you the beginning of the full quarter to come to Student Health or a local healthcare provider or a retail pharmacy to get those missing vaccines or blood tests, depending on what's going on. You will need to get all your vaccine records, and you can use our form to guide you through that process or your own vaccine records. Um, your healthcare provider can help you with this and provide missing vaccines and blood tests. And please submit even if you haven't done everything and know that you're going to need to get something at the beginning of the full quarter. Please submit what you do have so that we know that you are engaged in this process, and we can definitely advise you on next steps, which can be really helpful. In terms of the specific vaccines, the first vaccine is Tdap, which is tetanus, which is adult tetanus, diphtheria, and pertussis. Pertussis is commonly known as whooping cough, and that is what we are trying to prevent. Highly contagious, and there are outbreaks in countries without this vaccine quite frequently. We want you to have had one dose of this on or after your 11th birthday. DTaP, with a little t, or TD, do not meet this requirement. It needs to be adult Tdap. Just to confuse matters slightly more, some countries have adult DTaP, but it has a capital T. So if you're in any doubt, just submit what you have with your records and we can take a look at that. The next vaccine is MMR, commonly known, commonly shorthand for measles, mumps, and rubella. Um, this is 2 doses, with the first dose needs to be on or after your first birthday. If you received it before your first birthday, that dose does not count because you have circulating maternal antibodies that can wipe that immunity out. So this is why that rule is there. We need the 2 doses to be at least 28 days apart so that your immune system has had a full chance to build that those antibodies, and then that booster comes in to provide you with enough antibodies to, generally speaking, last for the rest of your life. If you don't have a record of these, or you think you had those diseases, then alternatively you can get a blood test called a blood titer, and that will indicate whether you are immune or not, determined by how many antibodies you have in your bloodstream. Um, if you are in a country that you received individual vaccines for these, you need to have had at least 2 doses of measles and mumps and 1 dose of rubella. Some people have had all sorts of different combinations. If we are not sure, we will request that you get a blood test to see that you have had adequate doses and have had adequate immunity. The same rules apply for varicella, which is chickenpox. So 2 doses, 28 days apart. Now, both varicella and MMR are live vaccines. So doses need to be either on the same day or at least a month, 28 days apart, because it can interfere with the development of antibodies. So if you got a measles, mumps, and rubella dose one day, and then you got your first varicella 2 weeks later, that varicella does not count. So it needs to be on the same day or at least 28 days apart. And we will let you know if that has happened, and we will recommend which blood test you'll need to get, or alternatively additional doses of a vaccine. And the fourth required vaccine is the meningococcal, or the ACWY, which is the type of strains of meningococcal. This does not include meningococcal B vaccine. This is a specific run-of-the-mill meningococcal vaccine. It is for students up to the age of 22. As soon as you turn 22, this is no longer required. However, it is strongly recommended up to the age of 23. We want you to have had 1 dose on or after your 16th birthday, because we know that it lasts about 3 to 5 years. So we really want to see some antibody coverage during those early years in university. Many people in the US have had that dose way before their 16th birthday. So it is a common vaccine that we will need to reach out and ask you to get a booster of. Common names of that include Menactra, Menveo, Medquadfi. There is an MMRV vaccine, which is a combined Oh, sorry, that's a different vaccine, but there is a vaccine actually that combines MMR and varicella together. Um, that just reminded me, but there is one, a meningococcal ACWY called Menquadfi, which is a newer vaccine, and again, doesn't include the meningococcal B vaccine. And as I mentioned when I went through our website, there are exemptions and there are specific forms that you need to submit if you are seeking either a medical or a religious exemption. And that goes to one of our medical directors to review. So it goes through a process. There are seasonal vaccines that we encourage you to get in the fall or the winter. And these include influenza and COVID-19 in the US. These are produced and released new variants of in the vaccines every fall, August, September. They are available in student health. We have what's called a fast track clinic that students can book into, and you can get those very quickly. You can decline or opt out of those vaccines if you choose. They are also available in almost all retail pharmacies and are covered by, at this time anyway, all US insurance, health insurance policies. They are considered preventative health, as are all of these vaccines. So a few frequently asked questions. People often want to know where they can find their vaccine records. You can look in your high schools, other early childhood education centres, your healthcare providers, clinics you've attended, paediatricians, or other colleges that you have been to if you're coming in as a grad student. So those are all good places to go. California Registry or Registry, whichever state or country you might be in, also often have these records. If you are unable to find any records, occasionally this happens. Medical offices close down, people don't have copies of their records. You can request blood tests for MMR and varicella, so that will give you those two requirements, and then you would need to get a boost of Tdap and meningococcal. They are boostable vaccines, so even if you got them but have no record of them, there's no harm getting another dose of those. Um, if these vaccines are not available to you in your country, in your state, or you don't have insurance to cover them and they're very expensive out of pocket, you can wait to get any missing vaccines on campus or in San Diego. There is no charge with the UC SHIP, which is the Student Health Services health insurance plan, and very convenient to come into student health and to nurses clinic to get any of these vaccines. As I said, we also have very fast turnaround clinics that run all year round, actually. If you had BCG as a vaccine, so BCG vaccine is a childhood vaccine given in some countries to protect against TB. Many students want to know whether they still need to get TB testing, and the short answer to that is yes, you do. It means that you come from a country with endemic levels or higher levels of tuberculosis. This vaccine does not offer lifelong protection from TB, and nor does it protect you necessarily from latent TB, as I mentioned before. So, yes, you do need to get testing. If your skin test was positive, you will need to talk with your healthcare provider and have them order a chest x-ray. If your vaccine records or your TB testing records are not in English, please have them translated. It doesn't have to be official translation, but it does need to be understood by us. If your religious beliefs exclude vaccines, then you do have the option for requesting for a medical exemption. We do ask that you get the titers, the blood titers, if that is the case, so that if there is an outbreak on campus, we can advise you if you have had an exposure to a student with one of these diseases. If you have an allergy or other medical reason why you can't get a vaccine, then you should take the medical exemption form to your healthcare provider. You could be on a medication or receiving treatment or have a condition that means that having a vaccine or a live vaccine is contraindicated, or you may have had an allergic reaction to a vaccine in the past. They are all reasons that you would qualify for a medical exemption. to go through some of the deadlines and enrollment hold dates. So for TB, you need to have completed both the TB risk questionnaire and testing if it's indicated. The deadline is July 14th. Holds are placed at the end of the month. And if you do get an academic hold because you haven't been able to get it done in time, then you will not be able to enroll in fall classes until you have submitted this documentation. It's extremely important. Make sure that you activate your My Student Chart by logging in that first time. That way, you will get reminder messages from me as we approach these deadlines and hold dates. I will let you know if it looks like you're about to get an academic hold. The way to get that hold lifted is not just by reaching out, it is by actually submitting the testing or completing the TB risk assessment. For immunisations, the deadline is July 14th, but you can, as I mentioned, you have until November 1st to get everything submitted. Please, please, please focus on making sure that you get onto these vaccines, particularly measles, mumps, and rubella. The US and many parts of the world are seeing a huge uptick in measles, which we haven't seen in a very long time, as well as cases of chickenpox. So very, very important that you know that you've got protection for that. These are highly contagious illnesses, and so we don't want you to have a whole lot of time off class as you're just coming into the university. And as I said, holds will be placed November the 1st, and that will prevent enrolling in winter classes. So yeah, that's slightly different to the tuberculosis. Student Health Services is it's a building right in the centre of campus, right near the Gesell Library, opposite Target. So it's on Library Walk. We have primary care providers, nurse practitioners, and physicians. We have some specialty services. We have our own lab, pharmacy. We have our own X-ray. We have our own insurance and health promotion. We have a lot of resources very available to you. We have nurses that you can reach out to through a nurse triage line. UC SHIP is the insurance that gives you full access here, but all students are eligible to use student health services. If you choose to stay with your own insurance or your family's insurance, there is an option called UC Raft, which is an access fee of $70 per quarter, which gives you access here to our primary care providers, our urgent care, in-house labs, and x-rays are all free of charge. It is a wonderful and very cost-effective option. If your insurance is Kaiser, Kaiser is quite a distance from campus, so having Raft and being able to access student health is a really good idea. It's very, very convenient. Willow is an app that was designed by UCSD students for students. It curates all the health and wellbeing resources on campus. It will give you reminders about your incoming requirements, so it's a really good idea to sign up for. And it will let you know of all sorts of fun things happening on campus as well. So we really urge you to sign up and take advantage of all of the various offerings that we have here on campus. Around health and well-being. And the last piece I really want to talk about is how to get help. And as I've mentioned, Ask a Nurse is really the best way. There is a team of folks here that I'll show you their pictures very soon. But there are also nurses that work remotely that are answering questions outside of our business hours. Our business hours generally are Monday to Friday, 8 to 4:30, 5 o'clock Pacific time. But there are nurses that take over after that, and also some work through the weekends, so you could expect to hear at any time. We have an email address there that goes to our medical records only if you're having technical difficulties. Please don't include any health information. Email is not a safe or secure way of sending health information. It is prone to hacking, but it is a very good way to get help if you're having technical difficulties. Everything is on our website, all the forms, lots of questions, how to sign up for My Student Chart, chart, how to link to my student chart, all of the services that are available at Student Health, all sorts of resources on health and surrounding resources around campus. And again, please just start this process as soon as you can so that right now, the trickle of submissions is low. And so we're moving through them in real time, same with questions. But as I say, as we get closer to mid-July, it gets extremely, extremely busy. So please start this process as soon as you possibly can. And then this is some of the team of nurses, and we have some medical assistants that are also assisting in this process. Our team has been doing this for many years and are very experienced in helping guide you through this process. So please feel free to reach out. You'll see some of these names at the bottom of your messages, and just know that you are communicating with a real person that is able to give you very accurate, up-to-date information. If they can't, they will forward it to myself and I'll be able to help you with most things. And then this is some more of our team. So we've got quite a number of folk that are processing these. And then these are all of the ways that you can contact us and our website and our online presence. So we welcome you to follow us in those ways. And now we will answer any of your questions.
All right, we will start to answer some questions that are in our question and answer feature here. The first question is I-20 required for vaccination for international students? Mine hasn't been issued yet.
No, the I-20 is not part of this process. It's certainly part of coming to the university, but it's not any part of the incoming health requirements.
If we have access to our electronic record of our all our immunization, does it need to be signed by our doctor or will it be acceptable to submit as proof?
It would be acceptable to submit as proof as long as it's got sort of two identifiers. So your name that matches your EPIC record on our end and your date of birth. If you're printing out an EPIC, it generally always has those two things on it.
Since MMR includes measles, do I add that for the TAT that asks about the measles SQ jet?
No. So the measles SQ jet is actually an individual vaccine that was given in some parts of the world up until very recently before the combined vaccine was available. So you would only enter that if you got those individual vaccines. Otherwise, you would be adding your MMR dates.
Is it a requirement to have the COVID vaccine after September 2024? If I get a booster now, do I need another dose in fall or winter?
The recommendation from a health perspective would be yes, because you really want the most updated version. But if you don't get one now, then definitely get one in the fall.
My x-ray was 2 years ago. Is it still valid?
No. So TB testing needs to be in the previous year prior to matriculation or prior to coming into the university. So that means it needs to be between September 2024 and September 2025. So you will need to get an updated one because it's obviously possible to have been exposed to somebody with TB in that time frame. So it needs to be current.
What do I need to do if I can't get a second or third dose of a vaccine before November 1st because the vaccine can't be closer than 6 months apart?
That is okay. Enter the dates of what you have had, and then, as I mentioned, you can get that final dose once you come to school.
Will you accept the MMR-V vaccine?
Yes, that is a more current vaccine, and you will be able to enter that, enter those under the dates. You would enter it as an MMR vaccine, and you would enter it also under the varicella vaccine, but that's a very good combined vaccine that is becoming more and more common to see.
If I choose to use the health insurance from my parents, work, can I still get care from UCSD Student Health Services if I get sick, or do I need to go to a doctor outside of the university? For this question, I would just like to preface that we are not the insurance expert. I will drop the insurance website in the chat. However, in this case, Annie can highlight some of other opportunities that you can enroll into RAFT. So I'll let her kind of speak on that.
Yes, and we mentioned that before. So you can still access services here, definitely. And if you're an enrolled student, you are eligible to use our clinic. The issue comes down to cost. So if you have an outside insurance, presently we are not running outside insurances, or we will be running a few limited ones. So that is why choosing to opt into RAFT would give you access to our services free of charge, mostly for in-house things. So that's what I would strongly recommend. And lots of students do that, and it works really well.
Fantastic. Is the Tdap, ADACEL, tetanus, diphtheria, acellular pertussis acceptable for the Tdap requirement?
Yes, it is. Yes, Adacel is the brand name for the adult version, along with Boostrix and another couple of other ones. So yes, that is absolutely what we want you to have had.
Is it a requirement to submit COVID vaccination now as well as the immunization? Also, do I need to fill out the other proof of immunity for the individual measles, mumps, and rubella vaccines if I had the MMR vaccine or not? Additionally, do I need to submit separate documents for other proof of immunity for X vaccine or not?
So you do one of those three options. You either enter dates for MMR, or you enter it as individual vaccines if that's what you got. Or if you didn't have records of either of those two things, then you would enter the blood test results and you would upload those lab results. So you don't have to do all three. You just really have to do one of those options. And all of those options are there. It doesn't matter if you leave things blank. It doesn't mean you can't submit the form, but just put all the information that you do have that's relevant to your vaccine history or blood test history.
If I filled out the MMR immunization date, do I no longer need to fill out the individual vaccines? And you just mentioned it earlier, Annie,
Yeah,
that you
that's
just fill out
correct.
once.
Yeah, lots of students do both, but it's not needed because the majority of people now don't get those individual vaccines. But we do still see a few folk that do, so that's why that's still available. Otherwise, people wouldn't be able to fill vaccine in under the MMR combined. So yeah, that's why that's there.
Okay. And then is the influenza and COVID-19 vaccines a requirement for enrollment?
No, those are required during the quarter. So you are fine with that. If you haven't had those yet, you can take advantage of those during the fall or winter quarters to get your immunity up at that time when we see lots and lots of cases here at Student Health of both those illnesses.
If I took the Tdap vaccines 2 days before my 11th birthday, would that be okay?
It would be okay. So there's a 4-day grace period, which is an acceptable period of time as per the CDC for a vaccine to have been given. Anything outside of 4 days would not count, but yours is going to count.
If I submit the immunization history right now for review, will I be able to go back and add new vaccines after I have gotten them?
You won't be, unfortunately, because the form can only be submitted the one time. However, if you have missing vaccines, you will get a message from one of our team, and you will be able to upload any other doses of missing vaccines that you get, and that nurse or medical assistant will add that into your file. So that is the way that you would do that.
Is the varicella vaccine the same as the chickenpox and varicella live vaccine?
It is. So chickenpox is like a common name for varicella. Varicella is the medical name for the virus, for the disease. So yes, but they're the same thing, can be used interchangeably.
Does it matter whether the vaccine dates are ordered oldest to newest or newest to oldest?
It doesn't matter, but if you've had more vaccines than are required, then put the most recent dates because the older vaccine, the more recent vaccines are more relevant in some ways. So if you've had 3 doses, for example, of MMR, put the most recent dates in rather than the older date.
If we need to do an update TB test, will that need to be done using the TB form and signed by a healthcare provider?
Yes, it does, preferably. If you absolutely can't get that, then you will need to submit some form of official documentation, like a report from the lab for a blood test or the chest X-ray report. Occasionally, students aren't able to get their doctors to review that. So submit to us what you have, and we'll let you know if we need anything else.
Is My Chart for UCSD available through the app on the phone?
Yes, it is. I will say this process is probably easier done through a desktop version, but yes, it is available on the app through your phone.
Does the MMR INJ full MMR
Yes.
fulfill? I think that's what they're
Yeah,
trying to
I
say.
think so. I think so. Yeah, the MMR injection does fulfill the MMR, but again, you do need to have had 2 of those with a good, 28 days between. But yes, that is what it is. It's given subcutaneously. They're live vaccines. It's mostly given in childhood, apart from a few instances. But yes, that will fulfill the requirement.
All right, we're going to stick around until about 2:55. If you have any other questions, please feel free to put it into the question answer portion. Right? Is the HPV-9 fulfill the HPV unspecified formulation?
It does, yes, because there are lots of versions of it. The HPV vaccine, there was HPV-4, there's been a few different iterations of it. And so, yes, it does. HPV is not a required vaccine, but a highly and very strongly recommended vaccine for everyone. It really has lowered rates of genital cancers and cervical cancers. It is highly preventative against the HPV virus, which is what we know triggers abnormal cell changes on the cervix and in other parts of our genitals. And so, yeah, we really encourage folk to have had that.
Where do we submit the TB screening test and immunization documents again?
So you go into my student chart, you go to menu, you go to immunization and screening. If the system has indicated that you need TB testing, a little upload button will remain there. So you go back and then you upload that form that your physician or your PCP has filled out, your primary care provider. And then that comes along to an in basket where the nursing team will review that and message you back.
And then once I enter all of my vaccine, how long will it take you to for you to let me know if I need any additional vaccines?
It really varies. It's really hard for me to give a time frame. We do say allow 7 to 10 days, and that's really at the absolute longest that we would ever need, usually around hold times. The nursing team will be very focused on TB, but we do have a team of medical assistants also that are working solely on the immunisation, so they definitely plug away at those. Yeah, 7 to 10 days at the longest, usually much quicker than that. But if you have all your requirements done when you first submit, you may not hear from us actually, because the system just goes, this person's done everything perfectly, and we don't even get alerted. If people are missing or things don't fall into some of those rules that I talked to you about, then we do get a message and we do review your records and we do reach out to you.
Is the meningococcal B OMV good to fulfill the requirement?
No. So meningococcal B vaccine is on the market. It is a vaccine you would discuss with your healthcare provider. It is not routinely given. It is effective primarily in times of outbreak. That is not the required vaccine, though. The required vaccine ends in ACWY. Menveo, Menatra, Medquadfir are common names of those. In other parts of the world, that it is called different things. But no, you do not need to get the meningococcal B vaccine unless your healthcare provider has advised that you need it.
I have the I think they're trying to say P, but or
It's B, HBV.
okay.
Yeah.
Okay. So I've had the HBV on my record, but it was from when I was only 2 months. Does this not fulfill the hepatitis B vaccine adjudication?
No, it does. It does fulfill. I mean, it's not a required vaccine, but again, it's a strongly recommended vaccine. And the hepatitis B vaccine is given from birth for many people. So those early vaccines do count. You need to have had 3 or 4 of those vaccines for adequate lifetime immunity. So yeah, those early ones are good.
Where should I put the HIB and HEPV and the pneumoconjugate vaccines?
So the hip vaccine is only relevant in childhood, so you don't need to enter that at all. The hepatitis B vaccine, there are available spaces for you to enter that in the immunisation form on my student chart. And I think there is space also for pneumococcal conjugate. So the pneumococcal vaccine is routinely given in childhood. Then as people between the ages of 18 and 65, some people, for example, if you have asthma, if you are a smoker or a vapor, and a few other health conditions, you may be recommended to get that pneumococcal vaccine. So there is space for you to enter that if you have had those vaccines.
Fantastic. You can clearly tell that Annie is the expert at this and I'm not. So our next question is, if I took the varicella 8 days before my first birthday and then the second dose a couple years later, would I still need to get the titers or does this fulfill the requirement?
So the first dose wouldn't count. So you have 2 options. You can get another dose, and then the second dose and the third dose would count, or you can get titers to see if you did build enough immunity from that first dose that was given a little too early. So it's up to you which way you want to go, which way your healthcare provider prefers you to go, and how much you love getting injections, or if you'd prefer a blood test.
What would we have to select if I need multiple screening for measles, mumps, and rubella on, for example, Quest?
It will say measles surface antibodies. That's what it will say, and and rubella. So, yeah, yes, when you're self-ordering tests, it should be obvious. It'll say titer or immunity test or surface antibody. You don't want to be selecting antigen because that indicates active disease. So it's antibodies that need testing. So anything that says antibodies to those is what you need to be um, checking off if that's what you need.
What would we have to select if I need multiple blood screenings for measles, mumps, rubella, for example? Oh,
Oh,
you just
that's
answered
fine.
this question. Yep.
Yeah.
Perfect. And then would hepatitis A work for Hep A PED or ADOL 2-dose scheduled?
Yes, it does. It does. So that means that Hep A, it means pediatric or adolescent 2-dose, and then there's an adult 2-dose, but you can have either or. 2 doses of vaccines, regardless of what age it's given, gives you lifetime immunity to hepatitis A. Again, this is not a required vaccine, but a strongly recommended. We have outbreaks of hepatitis A from time to time in San Diego, and it's very prevalent just over the border. And if you do travel abroad, you'll be asked to get Hep A. So it's a wonderful vaccine to have.
Since we don't have the meningococcal vaccine, how do we submit the form if we don't have that vaccine and can't input it?
Just leave it blank. The only date that you have to put in there that might be a problem is varicella. So we had to pick one vaccine to make the form submittable. But we want you obviously to add all your vaccines. But if you haven't had one, then put your date of birth in there because the system will flag it as not counting anyway. So that would be an alternative. But if you haven't had the meningococcal, just leave it blank, and then when you do get it, we'll be able to add it in. And if you get it at Student Health, it'll automatically go in.
If I exit out of the immunization screening page, will it save all the data I inputted for my vaccines?
Yes, I think there is a save option. So you can input what you have, save it, go away, get anything you need, come back, enter the rest, and then submit. So yes, there is that function, and I forgot because initially when we built it, that wasn't a feature, but it is a feature now. So that's a great option. Good question.
There's an option that says COVID-19 antibody test. Should I select that one on Quest?
It's not wildly helpful, and no. So COVID-19 antibody testing really isn't widely done in the US, and it doesn't really help hugely. You really want to get the most recent updated vaccine. A titer won't exclude you from needing the vaccine because antibodies don't last a long time from COVID, but particularly from the disease itself, like maybe 3 months. So it's not really of much value. Neither is it for pertussis, nor is it for meningococcal, but for MMR and varicella, it's very indicative of your current immune status and Hep A and B.
Does the HAV vaccine I received at 1 years old fill the Hep A pediatric or adolescent too?
It does, yes, but you do need to have had 2 doses. But yes, that pediatric version is totally acceptable.
Does the meningococcal MCV4P fulfill any requirements?
It does, yes. It's in the US, ours is MCV4C, which means conjugate. The P means polysaccharide, and that is totally acceptable and is it's just the delivery system of the vaccine, and it's totally fine, yes.
Does the meningococcal ACWY only count for meningococcal vaccine and not the meningococcal B?
Yes, that is correct.
Is there a separate section where we need to submit the influenza vaccine records?
Yeah, it's under preventative care. And at the moment, it opens up again, I believe, on August 1st, where you can enter that. But if you included it on any of your forms, the team would just enter those dates for you. Great questions, everybody.
That might be all of the questions we have for today. And just a reminder, all of our forms and information is on our website. If you have any questions, very specific questions concern, log into My Student Chart and then go ahead and message Ask a Nurse. We are trying our best to put a copy of this webinar onto our website as fast as we can. So check back on there. And I think that's it. Do you have any last tips for everyone, Annie?
Just get started as soon as you can so that we can help you get underway and you've got plenty of time to get anything that you need to still get to be compliant. And we're here to help you. So please feel free to reach out to us.
Fantastic. Well, that is a wrap on our webinar for today. And again, any specific questions, our team is here for you. Please head to My Student Chart and have a great rest of your day or night. And we'll see you soon.
Thanks, everybody.